Assalamualaikum warahmatullahi wabarakatuh. My name is Nelly Nabila binti Muhammad Zarul Isham and my metric number is 1222892. We are from group 5 and we have chosen the topic of age. For this topic, our group will focus more deeply on the elderly age group. We choose this topic because the number of senior citizens is increasing and they often face mental health challenges like depression and anxiety, especially after retirement or the loss of a spouse. This topic is very important in the field of counseling because many elderly people do not get the help they need. This may be due to stigma, financial problems, or lack of information. As counselor, it is important for us to understand the psychosocial needs of the elderly so that we can provide help that is more effective and full of empathy. Next, we move to the background and research finding. According to research, depression among the elderly is rising, especially when they have little social support or suffer from chronic health problems. Unfortunately, less than 3% of elderly people seek professional mental health treatment. Studies show that counseling can be very effective for the elderly, sometimes even more effective than for younger adults in certain cases. We also use the theory of diversity, which says that counseling must consider age, culture, language, and the social background of elderly people. In addition, the approach from World Health Organization, which is WHO, highlights that social support and community involvement are very important protective factors for their mental health.
For the immersive activity, we did two things. First, we watched the movie The Intern, which tells the story of a 17-year-old man named Ben, who returned to work after retirement. Through this movie, we learned that seniors can still make meaningful contribution to society and that work can give meaning to life and reduce loneliness. Secondly, we conducted interviews with several seniors in their 16 and 70. He shared his experience of dealing with loss after retirement and losing a peer. He stated that just talking and having someone listen was enough to help him emotionally. This shows how important consistent emotional support is for seniors. So, as a counselor, we need to use effective approach such as cognitive behavioral therapy (CBT), community-based intervention, family therapy, and social activities. Culturally and linguistically oriented approach such as that used in a senior center in New York can also be used as an example. Counselor should also be sensitive to the diverse language need cultural belief among seniors.
So I will continue about the presentation. So about the personal reflection, through this project, we really open our eyes to the reality of older people life. They are not just old people, but individuals with feelings, stories, dreams, and potential. Many of them carry emotional pain, miss their family, or still want to contribute to society even at their age. So, as a counseling student, we learn that working older people need a lot of patience and good listening skill. It's not just about giving advice. We need to be fully present, understand their life background, and realize that their values and culture are different from the younger generation. So, we also start to appreciate the diversity among other adults. Some are active and cheerful, while others are lonely and quiet. This taught us that counseling must be flexible and personalized for each person. So, personally, this project made us realize that all people, no matter how old, deserve to be heard and respected. We are now more aware of the counselor in creating a safe place, caring and supportive space for them. So, to conclude this project, show that older people mental health is a serious issue but often ignored. They face many challenges like stigma, feeling shy to seek help, and limited access to support service. From the film and interview we explored, we found two things that really have improved their mental health. The first one is social support, and number two is meaningful activities. When they feel appreciated and have a reason to be active, their emotional well-being will be improved. So, here are some suggestions based on our finding. The first one is increase mental health education for older people through talk, workshop or community program. The number two, start in the intergeneration program like in the movie The Intern, where young and the older people can learn from each other. Number three, open more counseling centers that use friendly language and respect their culture and background. Number four, train counselors to understand the unique problem of older people like losing a partner, feeling isolated or being afraid of learning. So, in the end, when we approach older people with knowledge, kindness and empathy, we are not only helping them, we are also building a more loving and caring society. So, that's all from us for our presentation. Thank you for listening and enjoying it.